My name is Tashai Byfield, and I will be presenting on influenza, the flu virus. Now, just some backstory on influenza. It has been around for a very long time and has caused well-known outbreaks. Some noticeable outbreaks include the Spanish flu in 1918, the Asian flu in 1957, and the Hong Kong flu in 1968. Another famous pandemic caused by the influenza virus was the H1N1 back in 2009. Now, these pandemics resulted in illnesses, significant illnesses, hospitalization, and deaths globally. Influenza appears worldwide and affects millions of people each year. It is more prevalent during the colder months in temperate regions, causing seasonal outbreaks, and in the tropical regions, influenza can occur throughout the year. Here I have listed a graph that shows the number of influenza outbreaks in the US between 2012 and 2013, both influenza A and influenza B. So influenza, which is commonly called the flu, has multiple strains of the influenza virus. The two main types of influenza virus that causes illnesses in humans are influenza A and influenza B. The genus and species of influenza A virus is the orthomyovirus A, and it's the same thing for influenza B. However, we'll swap out the A for the B. Common signs and symptoms of influenza is that it primarily affects the respiratory system. So common symptoms include fever, cough, sore throat, runny nose or stuffy nose. People would complain of body aches, headaches, they'd complain of being tired, and sometimes vomiting and diarrhea can occur. Right? So in extreme cases or severe cases, it can lead to complications such as pneumonia, bronchitis, and worsening of underlying conditions. Influenza is transmitted mainly through respiratory droplets, right? So when an infected person coughs or sneezes, that's how it is spread. So these droplets can be inhaled by people in close proximity to the infected person. It can also be spread through touching of surfaces or objects that are contaminated with the virus and then touching the eyes or the nose or the mouth, and that's how you will spread the influenza virus. Now with incubation period for influenza is typically 1 to 4 days. And during this time, an infected person may not even know that they're infected. So they may not experience any symptoms, but can still transmit the virus to others. The communicable period is when a person infected with the influenza virus can be contagious and transmit the virus to others from 1 day before the symptoms appear or to 7 days before getting sick. Period. Uh, in some cases, especially in young children and people with weakened immune system, the contagious period may be longer. So how do we detect um, influenza? Well, first, we use rapid antigen tests, and they're commonly used to identify the influenza virus by detecting viral proteins in a respiratory sample. We usually get that from the nasal or the throat swabs. We also use PCR tests, and this can also use to identify and differentiate the specific strain of influenza virus. Sorry. We can also use serological tests, and that can be used to detect antibodies produced in response to the virus, indicating past infection. Now, in most cases, influenza treatment it's self-limiting and resolve on their own with supportive care. So treatment focuses on relieving symptoms, and that include rest, staying hydrated, taking over-the-counter pain relievers, fever reducers. In some cases, in severe cases, antiviral medication may be prescribed as well. Control measures for uh, influenza viruses, vaccines. So vaccination is key in preventing and prevent is a key preventative measure and is recommended annually for individuals aged 6 months and older. Good respiratory hygiene, such as covering your mouth when you're sneezing and coughing, can also help reduce the spread of droplets. Regular hand washing with soap and water, or using alcohol-based sanitizer is also important. In healthcare settings, infection control measures such as your PPE, meaning your gloves, your gown, your mask, is vital in reducing the spread of influenza in the healthcare system. All right, so we have come to the end of my presentation. And my name is Tashai Byfield, and I have presented on the influenza virus.